Measures to strengthen and improve care, treatment, and support for persons living with chronic non-communicable diseases in the Virgin Islands are ongoing. The BVI has embarked on a 10-year strategy for the prevention and control of non-communicable diseases. Consultant Dr. Sandra Dillon, Director for the Chronic Disease Prevention Healthy Living in Canada, visited the BVI last month to conduct an assessment and develop a chronic disease management strategy. She says it is necessary to change the health system to better manage the huge numbers of residents that are now suffering from chronic diseases.
It's an enormously difficult thing to try to change the system because our health system is designed to manage acute illnesses. Yeah. And it's not designed at all to manage chronic diseases. So we really have to change all aspects of the health system if we're going to make a difference. And we have to make a difference because over half the population has a chronic disease, and it's costing pretty much worldwide 2/3 of the healthcare budget is being spent on chronic disease.
So you have a similar statistic in
Very
Canada?
Similar. It's similar pretty much all around the world. Mm-hmm. And the other statistic, which is frightening, is that only about 50% of chronic diseases are managed well.
Chronic non-communicable diseases include diabetes, heart and respiratory problems, and cancer. Dr. Dillon says the system can change, but the management of chronic condition changes, requiring various care and treatment.
But we can change, but it takes a whole system approach with all the different players involved in healthcare working together to make the system change. Well, one thing is that the patients need to be much better informed about their condition. So educating patients about their diseases is critical because they need to be vigilant for the signs and symptoms to watch for so that they can quickly get into the doctor's office or see the nurse before they start to deteriorate. So that's one of the main things that we need to do.
We have not been taking enough responsibility for our own health.
And we haven't known what to do. So not only have we haven't taken responsibility because we haven't known what to do.
So education is a major component.
Education is very important, and teaching people how to manage their own condition, because we manage them. We only spend about 1% of our time, at the most, in the doctor's office. So we are managing. We want to teach patients to manage well. And with a chronic condition, whether it's diabetes or hypertension or asthma, we have them, when you have them for decades, for life. And they wax and they wane, so they go up and down. And a lot of different providers are needed to help the patient manage their condition. So sometimes they'll need help from the nutritionist. Sometimes they'll need to talk to the pharmacist about their medication. So it doesn't remain the same.
Coordinator of Health Promotion Services, Ivy George, says BVI's 10-year strategy for the prevention and control of non-communicable diseases is aiming to change the behavior of residents. She explains the prevention component of the health strategy.
We are looking at things that the social determinants of health that happen outside of the Ministry of Health. So we are working with labor, education, we are working with healthy spaces and places, and we are working with schools. But there are also some people who have already gotten the disease or who have risk factors. And we want also to prevent them from not falling into the other stage. So we also need to strengthen what the health component as well of the program. So we are trying to also strengthen the capacity of the Ministry of Health to design programs that will do more than just raise awareness. We are hoping to do behavior change. But a lot of these things can be done at the community level by having the community involved. And I can't stress this point enough, that we really, if we're going to see the kind of changes that we want, that we're going to have good community buy-in.
Dr. Dillon says primary prevention is almost more difficult than the management of chronic diseases because prevention involves so many diverse stakeholders and it involves lifestyle change. This includes reducing alcohol consumption, smoking, managing stress, and exercise, but it also needs community involvement and supportive environment.
So what we're doing in primary prevention is we're looking at the key 5 risk factors, which are smoking, nutrition, alcohol, physical activity, and stress. Mm-hmm. And we're doing it across the sectors, so we're working across the age groups, and we're also working in different sectors like the community and in workplaces.
Okay, so you're looking to change lifestyles.
Exactly, yeah. We also need to have a supportive environment to help us change. So one of the things we're doing is we're looking at the built environment to see if when we tell people to go out and exercise, that they actually have a safe area to do this, with a pavement and a nice area to walk, where they feel comfortable and can go and do it. And when we tell people you have to eat better, we have to make sure that healthy food is accessible and it's not overly expensive. So that's making sure that we have a supportive environment, so it's not just about what you do.
Dr. DeLon is expected to submit a report on the areas that needs focus initially to better manage chronic diseases. The recommendations will be used to move toward an expanded chronic care model to improve care and treatment of persons living with chronic diseases here in the Virgin Islands.